people with bipolar disorder often feel like their happiness is pathologized because everyone is worried about them becoming manic. However, as we discussed, mania is not always happiness. And let's take a minute to recap our understanding of bipolar 1, bipolar 2, and cyclothymia. So bipolar 1 goes all the way up to manic, and all the way low is with deep major depression. Bipolar 2 goes all the way up to hypomanic, goes all the way down to a deep depression. Cyclothymia goes all the way up to a hypomania, but gets to like a moderate depression. And remember, our goal is euthymia, meaning stable mood. The goal is not just to not be manic, it is also to not be depressed. And guess what? Bipolar depression deserves a lot more attention than it normally gets. And when it's not addressed, people get off of their mood stabilizers and put themselves at risk again to become manic. So that's why it's important. So here are the FDA-approved medications for bipolar depression. And I will give you a brief rundown of each of them. The first one, quetiapine, also known as Seroquel. A useful medication overall, honestly. However, it hits a lot of receptors. It's what I like to call a dirty drug because it hits so many different things, and it can cause a lot of weight gain and sedation, and it can have a lot of nasty side effects. Still useful, but not my first go-to anymore. Olanzapine with fluoxetine, which is Prozac, together is FDA approved for treatment of bipolar depression, but I'm going to skip over that right now because it's not a single drug. Now, out of this entire list, lorazepam is probably my favorite one. And lorazepam is my favorite one for multiple reasons. Number one, it is truly weight neutral. People don't gain weight on Latuda like they do on other antipsychotics. However, cariprazine and lumateperone, also known as Capillata, also are weight neutral. But Latuda is still my favorite. You want to know why? Because Latuda in the United States is no longer under patent. So it used to cost like $1,500 a month, and now you can get it for $20 a month. No point in treating depression if you're just going to make people broke, right? That's not good. Latuda I've actually also found to be useful in people with severe irritability or like anger issues, and it's a great adjunct for treatment-resistant depression. Cariprazine, also known as Vraylar, is probably my other favorite medicine, but it is still on patent, so it's still very expensive, and insurance does not like paying for it. But what's cool about cariprazine is that it targets D3 receptor more than D2. D2 is the receptor that all antipsychotics target, but cariprazine has more affinity to D3 than naturally occurring dopamine. It's a pretty cool molecule. And lumateperone, I'm just going to say Capillata, is also on patent, so it's not cheap. But what I found very interesting about that one is it causes more pro-social activity in folks with like psychosis or mania. I know that was a lot, but there's still a lot more info out there. Let me know if you have questions.